Good day, students. Today we have a lecture by discipline Pediatric Dentistry. The theme of our lecture is genetic aspects of caries and periodontal diseases, hereditary diseases of hard tissue of the tooth, etymology, pathogenes, classification, clinics, and treatments. Hereditary diseases are understood as diseases with primarily technical defects in the cell software. The common etymology of hereditary diseases is based on mutations. Mutations are permanently inherited DNA damages. For the development of hereditary diseases, mutation is not always sufficient. It's connected with biological anti-mutational defense mechanism capable of correcting, neutralizing, eliminating mutant cells. The double character of the DNA helix is the reliability of the storage of genetic information. Animal formation is influenced by genetic factors. The genes that control the development of enamel and dentin have been identified. Abnormalities of these genes lead to congenital disorder of enamel and dentin formation. Genetic aspects of dental hard tissue diseases in children. Geneticists suggest that morphological abnormalities of the mesenchyme affects development of hard tooth tissue, primary and secondary mineralization of enamel, development of organs derived from connective tissue, fibrous structures of connective tissue are represented by collagen, elastin, and reticular fibers. Collagen synthesis is encoded by certain genes. Disorders of collagen synthesis during intrauterine development lead to genetically determined pathology of the connective tissue. Hard tissue of teeth developed from the mesenchyme and ectoderm have a connection with connective tissue. The group of diseases associated with congenital connective tissue pathology is manifested by a decrease in its strength. Genetics distinguish two groups of dysplasia. First group, combine systemic and hereditary syndromes, Ehlers-Danlos, Morphan, etc. The second group, hereditary connective tissue diseases associated with visceral manifestation. Autosomal dominant diseases and syndromes with impaired animal formation. Albrecht's hereditary osteodystrophy, Amela-Oniho-hypohidrotic syndrome, amelogenesis imperfect, hypoplastic type, generalized microdentia, amelogenesis imperfect second type, hypoplastic local, autosomal dominant, hyperostatic Lenz-Majewski dwarfism. Amelogenesis imperfecta second type, hypoplastic local, autosomal dominant. Mutation in the animal gene. Inheritance is autosomal dominant. Clinic. The animal is hard. The quantity is reduced. The hypocalcified form. The animal is soft. The amount is normal. Hyperostatic Lenz-Majewski dwarfism. Autosomal recessive hereditary diseases and syndromes with impaired animal formations. Acrorenal defect, ectodermal dysplasia, lipotrophic diabetes syndrome. Alaninuria with microcephaly, amelogenesis imperfecta and nephrocalcinosis, dystrophy of Conn's rods with imperfect amelogenesis, epilepsy and yellow teeth. Alopecia, contractures, dwarfism, and mental retardation progeny. Autoimmune polyendocrinopathy, first type syndrome. Hereditary disorders of hard tissue of teeth divided in three groups. Isolated tooth lesions, combined with general diseases, and rare hereditary disorders of hard tissue associated with general somatic disorders. The first group, isolated tooth lesions, hereditary disorders of the tooth structure, not classified elsewhere. include imperfect amelogenesis, imperfect dentinogenesis, odontogenesis imperfect, other hereditary violations of the structure of the tooth. The second group, combined with general diseases, osteogenesis imperfecta, marble disease, hypophosphatasia, familial hypophosphatemia, hereditary vitamin D deficient risked, etc. And the third group, rare hereditary disorders of hard tooth tissue associated with general somatic disorders, Ehlers-Danlos syndrome, brachioskeletal genital syndrome, etc. General signs of hereditary malformation of hard dental tissue. Hereditary pathology. Differential diagnosis is carried out with non-carious acquired malformation of hard tissue. Prevention and treatment. Restoration of the function of the dentition, aesthetics, inheritance type, autosomal domination, autosomal recessive, and X-linked. Defects are formed in the follicular stage, a violation of the construction of the matrix of enamel dentine hard tissues. Clinical signs. Changes in the shape of the teeth, color, structure of enamel and dentine. On X-ray, observed changes in structure of dentine, lace, and shape of the roots. Necessary. Examination. Medical genetic consultation. Dispensary observation by a dentist, pediatrician, and orthopedist. Preventions. Rehabilitation and normalization of the psycho-emotional state. Congenital disorder of the structure of the teeth. The most common are amelogenesis imperfecta, imperfect dentinogenesis, imperfect odontogenesis, Staten-Kapdepon syndrome, ectodermal dysplasia. Amelogenesis imperfecta. Systemic violation of the structure and mineralization of temporary teeth, permanent teeth, arise at the stage of education organic enamel matrix and intramandibular depopulation. Dentin, cement, pulp do not differ from the normal. Teeth are resistant to caries development. On these photos you can see the example of amelogenesis imperfecta. Classification of imperfect amelogenesis by Wittkop. Type of amelogenesis imperfecta. Hereditary enamel hypoplasia associated with a violation of its matrix. Autosomal domination point hypoplasia. Autosomal domination local hypoplasia. Autosomal domination smooth. Autosomal domination straightforward. Autosomal domination root. Autosomal recessive root linked the X chromosome domination smooth hypoplasia. Hypoplasia is a deficiency of enamel by decrease in its quantity, a decrease in the production of an enamel matrix. Enamel is thin. The configuration of the pulp, chamber and roots channels is saved. Causes: genetic and external factors. Hereditary hypomaturation imperfect amelogenesis second type. Hereditary enamel hypoplasia associated with impaired maturation. Autosomal domination hypomaturation is combination with taurodontism, hypomaturation pigment, autosomal domination snow cap, autosomal recessive pigmented, spotty type in men, striped in women, X chromosome linked recessive. Hypomaturation. Enamel of various colors, from white to yellow with brown specks. Abnormal aberration. Hypomineralizated, hypocalcified type, hereditary hypoplasia, associated with hypocalcification. Autosomal domination hypocalcification and autosomal recessive hypocalcification. The enamel is formed but not sufficiently mineralized, soft and mottled. Impaired enamel maturation with hypoplasia and taurodontism. Syndromic association and chromosomal diseases with sign of hereditary and perfect amelogenesis. Autosomal domination, furrowed hypoplasia and taurodontism. Autosomal domination, subtoothed hypoplasia and taurodontism. Etiological factors. Pathological mutant genes. The formation of the enamel matrix is disturbed. The ripening process is disturbed. Hypocalcification and hypomineralization of enamel. General signs of enamel damages with imperfect amelogenesis. Temporary and permanent teeth are affected, regardless of group affiliation and teaming of formation. Dentine, cement, pulp do not differ from the norm. Teeth are resistant to caries development. Clinic. Thinning of enamel, color change from yellow to brown. Violation of transparency of the enamel, plaster teeth. Violation of the surface structure, pits, grooves, erosions. Partial or complete absence of enamel. Pathological abrasion. Complaints: cosmetic defects, chipping, abrasion, pain, form seminal irritation. This X-ray shows the hypoplastic type of amelogenesis imperfecta. On this photo you can see point hypoplasia with autosomal domination type of inheritance. This slide demonstrated smooth hypoplasia with autosomal domination type of inheritance. This photo demonstrated hypoplasia with inheritance linked to the X chromosome. This photo demonstrated hypoplastic type of amelogenesis imperfecta. These two photos demonstrated raw hypoplasia with autosomal domination type of inheritance and rough hypoplasia with autosomal recessive type of inheritance, agenesis aplasia. A large amount of supragingival dental plaque, pronounced thermal sensitive of the teeth, frequent combination with open bite. Hypomaturic type of imperfect amelogenesis. Enamel is of normal thickness. The content of minerals is less in comparison with the normal, but more in comparison with hypocalcification type. Clinical manifestation of hypomaturation type. Enamel color from matte white to light amber. There may be post-erupting chipping of the enamel. Dual white enamel on 1/3 to 1/8 of the ensical edge and or tabulars of the lateral teeth, snow-covered teeth, permanent teeth. Certain group of teeth are more often affected. Enamel maturation disorders. Hypomaturation. Violation of maturation with autosomal domination type of inheritance on the form of a snow cap. Type of hypocalcification of amelogenesis imperfecta. The process of enamel mineralization is disturbed enamel of normal thickness but poorly mineralized. Clinical manifestation of hypocalcification. The first. Change in gloss and color of enamel. Yellow, dark yellow, brown. Normal amount of enamel during eruption. Frequent post-eruptive chipping. Cervical enamel often retained. Enamel hypocalcification. Hypocalcification with autosomal domination type of erythemes and hypocalcification with autosomal recessive type of inheritance. Violation of enamel maturation with hypoplasia and taurodontism type FOS, imperfect amelogenesis. Violation of maturation with autosomal domination type of inheritance with forward hypoplasia and taurodontism. Violation of maturation with autosomal domination type of inheritance with subtle hypoplasia and taurodontism. Refers to size anomalizing the shape of teeth according to International Classification of Diseases 10. Enamel of temporary and permanent teeth of various colors. Pathological aberration. Radiographic features: large cavities, elongated crowns, short roots, greater distance from the occlusal surface to the bifurcation. Temporary and permanent molars are affected. On this slide describes the X-ray of taurodontism. Autosomal recessive inheritance. Typical for kindred marriages between cousins and siblings. Violations: hypoplasia, hypomineralization of enamel in combination with visual impairment. X-linked amelogenesis imperfect. Clinic: discolored enamel, loss of transparency, furrows. Therapeutic tactics: recovery, function, and aesthetics. Functions include altitude recovery bite, orthodontic treatment, prosthetics. Aesthetics consist of direct and indirect restorations after remineralization therapy. Treatment of amelogenesis imperfecta. Treatment depends on the severity of the symptoms. Target: decrease in sensitivity, prevention of chipping and abrasion, improving aesthetics. Possible treatments: remineralizing therapy, restoration in several cases, temporary teeth, standard or custom molar crowns, permanent teeth, covering with adhesive materials without or with mineral preparation, orthodontic crowns for premolars and molars. After the completion of the formation of the dental system, prosthetic and aesthetic restoration. Interdisciplinary approach. This slide describes the restorative and function treatment. This slide is also demonstrated the photo of restorative and aesthetic treatment. Hereditary dentin diseases, shields. Dentinogenesis imperfect divided on 4 types. Dentin dysplasia as well divided in 2 types. Type first, root dentin dysplasia. Type second, dysplasia of dentin crowns. Dentinogenesis imperfecta is an inherited disorder of dentin development. This is the rare diseases. It is characterized by insufficient development of the roots of the teeth, shape enamel. The enamel is not changed. It breaks off easily due to a weak bond with dentin. Teeth are resistant to caries, easily to wear and mobile. Dentin developmental disorders. Dentinogenesis imperfecta, divided on 4 types. The first type is also divided on 2 groups. The group A and hereditary aplastic dentin. Schilt's second imperfect dentinogenesis inherited autosomal domination. Group B, Schilt's third imperfect dentinogenesis, are rare diseases of certain populations of people. Type 2. Dentin dysplasia, Gabdepona dysplasia. Crowns of teeth of normal size. The color is not changed. The pulp chamber is obliterated. The roots of the teeth are practically absent. The third type, dentin second dysplasia, inherited in an autosomal domination manner, clinically noted root dysplasia, crowns of teeth of normal size and color. The fourth type, fibrosous dysplasia of dentin, crowns of teeth of normal size and color. On this slide, demonstrated photo by imperfect dentinogenesis type 1, osteogenesis imperfecta. This slide demonstrated photo by imperfect dentinogenesis, the second type. State and Kapdepon-Hodge syndrome. This slide is also demonstrated imperfect dentinogenesis, the second type, state and Kapdepon-Hodge syndrome. On this slide show is a X-ray of Stanton-Kapdepon-Hodge syndrome and perfect dentinogenesis, the second type. Odontogenesis imperfecta Stanton-Kapdepon syndrome. After the teeth have erupted, the enamel is chipped off, forming sharp edges. The tooth cavity and root canal are narrowed, sometimes obliterated. Exposed dentine wears off quickly. This slide demonstrated the photo and X-ray Stanton-Kapdepon syndrome. Dentinogenesis imperfecta, the third type. Described by Whitkop in 1988. Characterized by bell-shaped crowns, multiple opening of dental cavities, especially temporary teeth. On this slide, demonstrated by X-ray and photo of dentine dysplasia, the first type, dentine root dysplasia. This slide demonstrated X-ray of dysplasia of dentine crowns, dentine dysplasia, the second type. Odontodysplasia, nail dysplasia and hypodontia. Autosomal domination inheritance type. Disorders of enamel and dentine development. Temporary and permanent teeth are affected. Enamel and dentine are thin, large tooth cavities with possible denticles. The patient has thin, sharp space curly hair, dysplastic nails. Focal odontodysplasia, Robinson syndrome. Anomalies in the development of group of teeth, incisors and canyons in 60% of patients. There are cases of focal odontodysplasia with disorders of individual parts of the body, adentia, osteoporosis of alveolar bone in the area of dysplasia teeth. The type of inheritance of autosomal domination and autosomal recessive. Therapeutic tactics. Endodontic treatments according to indication in the earlier stage of tooth development. Removable and non-removable prosthetics. This slide shows the photo of the example of treatments. Dentine changes in combination with general diseases. Hereditary aplastic dentine. Incomplete odontogenesis. Synonyms: odontodysplasia, Staten-Kabde-Pons syndrome, Kabde-Pons dysplasia, Ehlers-Danlos syndrome, Brachioskeletal syndrome, ricket resistant to vitamin D, hypophosphatasia, marble diseases, hereditary osteogenesis imperfecta. Lenz-Majewski syndrome. Apalacine teeth, blue scleres, Formian bones. Described in 1981. Hypostatic dwarfism clinics. Malformation of the craniofacial region, skeleton, skin, nervous system, micrognathia, small tongue, mental retardation. Hereditary diseases and discoloration syndrome. Ehlers-Danlos syndrome. The type of inheritance of autosomal domination, autosomal recessive, and linked to the X chromosome is recessive. A rare connective tissue disorder that affected the skin and joints. Periodontal lesions and roots anomalous and characteristic. Clinic. Fragile skin, hypermovable joints, short stature, generalized periodontitis, enamel hypoplasia. Generalized periodontitis of temporary and permanent teeth. Profuse bleeding when removing teeth. Radiographical. Narrowing of the root channel, calculin in the cavities of the teeth, root anomalies. Bone sclerosis, skeletal anomalies, osteogenesis imperfecta. Fragile cornea, blues clear, myopia, skin hyperelasticity, micrognathia, gingival hyperplasia, hypodontia, discoloration of the enamel, crowns and pulp chamber are normal, but filled with atypically dentine, increased tooth abrasion, skeletal anomalies. Hereditary osteogenesis imperfecta. Genetically detergent diseases, autosomal recessive, autosomal domination. Forms. Imperfect bone formation. Disease of crystal boys. Florix disease is found in newborns. Clinical picture. Fracture of tabular bones, ribs, collarbones, slow growth, fluttering of the skull, blues clear of the eyes. Lobstein disease. Ossification of the fontanelles is not large manifested itself in the first year of life. Fractures of tubular bones, marked abnormal abrasion of temporary and permanent teeth, obliteration of root channels. The color of the teeth is gray-brown. The crowns are watery transported. Differential diagnosis with opal dentine. This slide demonstrated enamel hypoplasia in osteogenesis imperfecta. Brachioskeletal syndrome. Craniofacial anomalies, prognasia, cleft palate, hypoplasia of the middle part of the face. X-ray. Multiple cysts of the jewels, dentine under development. Rickets resistant to vitamin D. Growth retardation, deformation of tubular bones, low laxity, reduction of jewels, teeth, enamel unchanged. X-ray. Molar cavities are enlarged. Hypophosphatasia. A decrease in alkaline phosphatasia in the blood, elevation of bone mineralization. Characterized by skeletal deformities, early loss of desiccation teeth, impaired calcification of the crowns of temporary and permanent teeth, hypoplasia. X-ray. Underdevelopment of the alveolar process, osteoporosis, impaired root formation. Marble disease. Albers-Schoenberg. Hepatosplenomegaly, an increase in the volume of the skull, a tendency to abscess, delayed teething, enamel hypoplasia, edentia, retention. X-ray. Jaw bones are compacted marble, underdevelopment roots, alteration of tooth cavities. Treatment principles. Endodontic treatment according to indications. Monitoring the condition of periodontal tissue. Reducing the hypersensitivity of dental hard tissue. Treatment of dentinogenesis imperfecta. The target of treatment of dentinogenesis imperfecta. Prevention of tooth abrasion. Improving aesthetics. Preservation of chewing function, bite height. Possible treatments. Temporary teeth. Standard or customized crowns on molars. Permanent teeth. Coating of occlusal surfaces. Premolars, molars with adhesive materials. After the end of the formation of the dental system, prosthetic and aesthetic. Restoration. Protective mouth guards at night after the eruption of permanent teeth. Treatment of failed odontogenesis. Purpose: prevention of abrasion and, as a result, rapid opening the tooth cavity. Methods: even partly covered with metal crowns, serrated temporary molars, permanent premolars, and molars. Mucopolysaccharidosis. Autosomal recessive inheritance. Clinic: short stature, facial abnormalities, thin hair, white mouth, gray enamel, multiple caries. Sickles syndrome. Heterogeneous autosomal recessive diseases. Clinics: growth retardation, mental retardation, microcephaly, bird-headedness, high palate, adentia, animal hypoplasia. Ichthyosis, atresia, and photophobia, described in 1990 by MacLeod. X-linked recessive disease. Clinic: hypohidrosis, follicular ichthyosis, photophobia, short stature, mental retardation, animal dysplasia. Ectodermal dysplasia, a group of rare congenital hereditary diseases. Clinically, there are two different types: the hydrotic form and the X-linked recessive hypohydrotic form. The disease is transmitted by the X-linked recessive route. The carriers of the pathological genes are women, and the completely symptom complex is expressed in males. Clinic. Formation of disorder and congenital absence of teeth. Disorders of the development of the skin, hair, nails, sebaceous and sweat glands, face dysmorphologenesis, multiple caries, generalized periodontitis. There is an increase in temperature, convulsions, mental retardation, asthma, eczema. Ectodermal dysplasia, dry skin, reduced bite, dry broken hair, eyebrows. Treatment of congenital disorder of dental development. With insufficient amelogenesis and odontogenesis, it is recommended remineralizing therapy, coating with gels, varnishes, deep fluoridation, application with calcium preparation, Calcex. A course of endogenous remineralization therapy. The use of calcium-contained preparation, calcites, calcimine, biotric denta, osteoid. Restoration and prosthetic of teeth. Whitening and restoration of teeth. Hereditary periodontal diseases. Types of periodontal diseases. Depending on age, bone atrophy, oral hygiene, and the presence of local contributing factors. Gingivitis, inflammation of the soft tissue of the periodontium. It begins with localized gingivitis. Periodontitis may develop with significant atrophy of bone tissue and loss of teeth. Periodontitis combines inflammatory and destructive process. Geneticists have identified an important role in the pathology of periodontitis and periodontal diseases of proline-rich proteins that regulate the formation of dental plaque and the importance of oral hygiene. Inflammatory periodontal disease. Molecular biology, combined with clinical researching, has identified hereditary predisposing factors for the development of periodontal diseases and periodontal symptoms. Periodontitis is a multifactorial disease. The etiological basis is formed by variants of genes, predispositions, the damage of which is realized against the background of unfavorable environmental factors, microflora, systemic diseases. Early periodontitis. Early periodontitis, localized, pubertal, and generalized adolescence, is an important genetic study. This pathology can be observed in family members. The genetic conditions that determine the predisposition of diseases have been determined. Periodontitis, periodontalysis with clinic neutropenia, Papillon-Lefèvre syndrome, hypoimmunoglobulinemia, uncompensated diabetes mellitus, etc. Some forms of early periodontitis are associated with dysfunction of phagocytes or their attachment to the walls of blood vessels. Sign of adolescent periodontitis. Fast, vertical, progressive destruction of periodontal bone tissue. Earlier tooth loss. Traumatic occlusions. The family nature of the disease. Type of inheritance of adolescent periodontitis. X-linked domination type. Autosomal recessive type. Dominant type of inheritance. Bogman and co-authors found a link between adolescent periodontitis localized on the 4th chromosome with other dental diseases, Shields type 3, dentinogenesis imperfecta. The interleukin-1 gene may be a predisposing factor for periodontitis. Papillon-Lefèvre syndrome, described in 1924. Congenital pathology of an autosomal recessive nature. Characterized by palmar-plantar dyskeratosis and progressive. Lesions of bone tissue, periodontitis, tooth mobility. Separation, growth of granulation, loss of the teeth. By the age of 14-15, children lose their teeth. Non-inflammatory periodontal diseases of hereditary genes. Desmodontosis, Gottlieb syndrome, is a primarily dystrophic process with rapidly progressive periodontitis. Form, localized, generalized. Inflammation developed secondarily. There is a rapidly painless tooth loss. Juvenile form of desmodontosis, the type of inheritance is autosomal domination and X-linked. Fibromatosis of the gums. The type of inheritance is autosomal dominant recessive with different penetrance. It can appear in the first year or at 10 years of a child life. The disease is being characterized by rapidly progressive coarse and non-inflammatory fibrous enlargement of the gums of the upper and lower jaws. There are multifactorial forms. Thank you for your attention. Goodbye.